Hello everyone, it's Melissa Sweet here, public health journalist from Croakey News. We're at the AHMRC Cancer Forum in Sydney. I'd like to acknowledge that we're on Gadigal country and to pay our respects to elders past, present and future. We've just heard a very powerful story from Desmond McGrady. Desmond, could you tell us a little bit about yourself, where you're from and what you've been talking about this morning?
My name's Desmond McGrady. I'm from Queensland. I'm a Kamilaroi man. I was here today to present my story and my journey through cancer.
Yes, and you shared a lot of your reflections. You had a rare head and neck cancer, you had intensive radiotherapy and chemotherapy. What helped you get through that journey?
It's the determination of wanting to battle the cancer and finding ways that's going to help you as an individual going through this process of cancer, and having the adequate resources to use. Sometimes within the system there's not those resources on hand, but sort of conducting your own investigation of what suits you as a person to battle through this treatment process as well with the cancer.
And you told a beautiful story about a friend who walked with you literally and metaphorically through your cancer journey. So why was that important?
It was very important because it was something very supportive and you don't feel alone. So having that friend or just an individual walking with you, giving you that motivation, and then using the exercise as a tool, but also I was using it as a way of the treatment process as well, exercising, getting your body pumping and everything like that. So thinking that in this process it was working, and just on the other end of the treatment, I could tell you that it did work, a lot.
You really felt the benefits.
Yeah.
And you shared a beautiful reflection. You said, how important it was having someone who sat with you without looking at the time.
Yes, that's correct. During the chemo treatments, we'd spend the whole day at the hospital, sitting in a chair, having the chemo or the radiation treatment, and at that time we'd feel alone. And just having someone beside you, if it was family or not the family, it could be just a friend or just someone in general to talk to, you didn't feel alone through that process, and it would make you feel a lot more comfortable, and I guess you just don't feel alone and you'd feel more supportive through that process.
And the other thing that you talked about helping you a lot was having traditional healing, massage and bush medicine. Can you tell us a bit about that?
Yes. So I was struggling with weight, in putting on weight on the nutrition, trying to pump that nutrition back into my body, and I would explore different avenues and ways of how I could make better this process, and turning towards what was actually there. And most people don't actually know what's actually out there unless they sort of investigate and see what's out there. But I turned to my auntie for the traditional Aboriginal massage techniques, and the bush medicines and rubs, and I gained the 10 kilos finally, got some really good results out of that.
And what difference has the weight gain made for you? Why is that so important?
Well, nutrition is a way of helping the immune system, and once we get the right nutrition into our bodies, then we're a bit more better at attacking those flus and colds or what other sickness that we may occur. And we need to be on top of our making sure we've got our nutrition in our body's intake, just to fight off those nasties that we can run into.
And one of the other things that you shared with us is how you're now working to ensure that other patients, particularly Indigenous patients, have better access to support. So what are you doing around that?
So usually time to time I still have to, unfortunately, report into my doctors and clinics, and return back to my main hospital for for checkups and MRI scans, but along this process of in between, I'd like to help other people, our Indigenous people as well in the process, and I just really like helping other people, and after going through this journey, and I do a lot of reflection, and I think, you know, a lot of voices are not heard, so I'm just here to help in every way possibly I can.
What do you hope will come out of your presentation to the forum today?
It's more about, for myself, is the supporting groups. We need to be able to have our Indigenous cancer support groups. We need to be able to have an area where we could have a yarn and have a talk, but also inviting professionals in to talk to us in that environment to help us, not only as a patient but as a carer, someone that might be caring for our Indigenous people through cancer. So it's more about a supportive process during this time, yes.
Thank you very much for sharing some of your story with us.